Something that's really helpful in practice is actually implementing the FAS scale. So FAS stands for fear, anxiety, and stress. And this is something that clients aren't necessarily good about recognizing, but us as professionals need to recognize these nonverbal or sometimes verbal cues. So we tend to keep on going and going and going until it becomes a safety risk. That's not the point that you stop. You stop when you notice that the patient is uncomfortable. So signs of that, discomfort, stress, these are all things that we know by lip licking, yawning, excessively panting. They're not hot, it's the middle of winter. They're getting worked up because they're either anticipating fear or they're experiencing fear. So that anxiety, that excessive vocalizing, that pawing at the appointment door, that doesn't look good, and they're really, really stressed out. So you can do a couple of things. You start with your treat ladder, you start, what I call buttering them up. You talk about what the client should expect before the appointment to bring in their toys, their treats, but you want to stop before it gets to that point of escalating to where it's a safety concern. Not only is it better for client perception, staff safety, but you want to make sure that the pet isn't leaving on that bad note, that the pet wasn't held down for its vaccines, that the pet wasn't screaming to the point where the clients were so upset they tell you to stop. So you want to keep on making it a positive experience, and when the pet tells you that they've had enough, which is freezing, all right, instantly tensing up, obviously lip lifting, things like that. When you're starting to see the pearly whites, they're not happy. And clients pick up on that too. So things that you can do is just really communicate with the client what your goals are. So Mrs. Smith, our goals are to make sure that Fluffy's happy when he's here. I'm actually not getting a really good physical exam because he's so worked up. Maybe what we can do is we're gonna stop here for now and we can see Fluffy in 2 days. I'm gonna send home some medication just to help his anxiety for the appointment, and I think you'll see that he's a lot more comfortable when he comes back. And clients like to see that. They'd like to see their pet relaxed. Certain things they're not gonna pick up on, those low signs, maybe the yawning, lipping, but they see it when they flash their smile, right? And we realize that it's not safe to go forward. The dog poles, the rabies bite stick, those are things of the past. They're really archaic. They serve a purpose, but in general practice, they really don't. There's so many more things that we can do to keep our patients comfortable and keep staff safe. So in the Fear-Free Toolbox, there is this really, really nice sheet, and it's super easy to follow, and we actually show this to clients. So green light means go, yellow, patients are getting a little iffy, you might want to slow it down. We want them to be comfortable as they go forward, and red is stop. Stop is very obvious. These are the places where we typically in veterinary medicine so far have been like, oh, I don't know how this is going. Not really. But for the patient, they've already mentally got to that point to where they're not going to slow down, they're not going to de-escalate, and we want to be able to capture them when they're still in a really, really good positive state of mind. So we want them to be relaxed, laying comfortable. Bella's a really, really good example of that right now. Even though she's had a really, really stimulating morning, she's comfortable and relaxed. Her back is actually facing me. She feels really comfortable. She's laying down. She's not really haunch ready to pounce up. Cats, when you start seeing that hissy tail going, and when you start hearing them vocalize, showing their teeth, being disinterested and engaged can be just a cat being a cat, but with dogs that are a little bit more socially bonded to us, when they start going away in the corner, when they start hiding under that client chair, we want to try to bring them back to the positive side, right? We want to start offering them easy cheese. We want to get out the squeaky ball. We want them to kind of be distracted from what's going on, but make it in a positive experience. So when a pet's underneath the client chair and they're just sitting there trembling, we're not going to grab on that leash and start reeling them in. That only makes it worse. So think about with a pediatrician and when you have a child at the doctor's, you're going to want to give them things to play with. You're going to want to give them a lollipop. You're not going to try to give them a lollipop when they're screaming and they're so upset it doesn't help them then. So you really want to make sure that you're minimizing that stress and fear. And when you see those signs, you kind of step back a little bit, stop, reevaluate, and try to continue on a positive note.